This is Van Tenpenny reporting for the United Steelworkers, Local 1055 in Laverne, Tennessee. We're going to speak with Vonda McDaniel, the pension insurance rep for the local. Vonda, could you tell me how the current proposals on pension insurance will affect the workforce at the Laverne plant?
Yes, it will increase out-of-pocket cost around 400%. We're going from a weekly rate to a proposed monthly rate, which is quite a significant increase. In addition to that, the stop losses that we now have, the company proposes to increase those stop losses. And on our prescription drugs, they propose to go from a set cost to a percentage of the cost of the drugs, which is significant considering the high cost of drugs these days.
So with these costs in place, and the proposed cuts in the payroll down to $13 an hour, we are looking at a workforce that could subsequently be in the rears come payday, paying for medical costs and their insurance. What else on the insurance part, how else would that affect, say, going to the doctor or buying your prescriptions, or the retiree aspect of it? How would that affect the retirees?
Well, at least as active employees, to some extent, we have the ability to work some overtime, or at least we have in the past prior to this economic circumstance that we find ourselves in, to make up some of that cost, where our retirees are on a fixed cost based on their pension checks. They don't increase. They don't get cost of living increases. They don't get anything to help compensate for the rising cost and responsibility that the company is trying to place on them. In terms of what we're all experiencing, we have been an above market in terms of wages and benefits for a long time. The company has touted that as, that we have a world-class workforce and we compensate them well. But what they propose in this bargain is, in some cases, we'll be lucky if we maintain living wage standards based on the proposed wage cuts and the proposed benefit increases that Bridgestone proposes.
So by taking us down to that level of cost structure, if that's going to affect the active employees that way, what about the retirees? How will it affect them in the long run with their Medicaid eligibility, the amount of money spent to pay for their health care, and that sort of nature?
Well, when the government guarantees pensions, and so whatever you walk out the door with is pretty much what you have for the rest of your life, where benefits are negotiated every contract. And so that has quite a impact on our retirees because they have no control over this cost that seems to be increasing every 3 years. And at this point, the proposals that the company currently has on the table, if you retire prior to the 2000 agreement, it really makes it very difficult. You begin to have to make those decisions about whether to buy food or to buy prescriptions. So it's really a very dire circumstance that we find ourselves in, unfortunately.
There you have it, folks. Vonda McDaniel, pension insurance rep from Local 1055, Laverne, Tennessee. This is Van Tenpenny reporting for SolidarityNews.com.